Warning: don't take another drug until you're aware of how you're being conned.
Osteopenia is defined as a condition where bone mineral density is lower than normal, considered by doctors to be a precursor to osteoporosis. Osteoporosis is a progressive bone disease characterized by a decrease in bone mass and density, which can lead to a risk of fracture.
Fosamax is a drug mainly used to treat osteoporosis, a disease that makes our bones become thin, weak, and easily broken. Here with us today to talk about Fosamax and the recent developments is attorney John Foy. John, tell us a little bit about the drug and the debilitating condition that some people are having.
Absolutely. Osteoporosis affects more than 28 million Americans each year, 80% of whom are women. Fosamax is the most widely used drug in its class and was prescribed more than 16 million times in 2006. It's been on the market for more than a decade. Fosamax, however, has been linked to osteonecrosis of the jaw, also known as dead jaw. Osteonecrosis can result in facial disfigurement, and the bones in the mouth and jaw tend to die and rot away. Dead jaw is very painful and gets worse over time. As it progresses, the soft tissue in the mouth swells, becomes infected, and eventually the jawbone becomes exposed and visible in the mouth. After the dangers of Fosamax were discovered, the FDA asked drug makers to include labels warning of the debilitating condition.
Thanks, John.
Thank you.
For more information about Fosamax and osteonecrosis, call 404-879-7518.
The Bone Measurement Institute is a front group formed by big drug maker Merck to help expand the market for its drug Fosamax by encouraging doctors to use bone measuring devices in their offices and convincing women at or around the age of menopause that they have a new, little-known condition called osteopenia. The Bone Measurement Institute targets women in their 50s and makes them believe that their bones are in such a weak condition that they require medical treatment.
This institute will support research and development of technologies that have the greatest potential for increasing the precision and reducing the cost of bone mass measurement, and will educate physicians about other related bone technologies.
Jeremy Allen is the Vice President of Merck and President of the Bone Measurement Institute. Conflict of interest much?
Wait, there's more!
Wait, what? There's more?
Oh my God. Jeremy Allen is not only the president, but also the one and only employee of the Bone Measurement Institute.
Truth is, we all have osteopenia.
You mean I have it?
I have it?
I have it.
I have it.
Osteopenia naturally occurs in people between the ages of 30 and 40. Merck cons women into thinking that they need this medicine in order to prevent a naturally occurring condition that we all experience. Merck licensed the bone densometer, which is made by Lunar Corp and Hologic Inc. The drug companies then made the machine available in doctors' offices and entered into agreements to reimburse them for scans.
Medicare will completely pay for bone mineral density testing. Doctors have also been added to the reimbursement list of Medicare coverage. Medicare is paying the average physician a bonus of 0.21% per patient.
The Bone Mass Measurement Act. In 1977, the Bone Measurement Institute and other organizations lobbied to pass this act. This act changed Medicare reimbursement rules to cover bone scans. This causes women to be pushed to get bone tests done by doctors.
Since Fosamax was released, medical professionals have scrutinized the problem associated with the drug. The first offense was when the FDA sent Merck a warning letter for overstating the benefits of Fosamax while minimizing the risk. The second was in 2008 when the FDA warned that bisphosphonates were linked to debilitating bone, muscle, and joint pain. In 2009, a study in the New England Journal of Medicine linked Fosamax use to esophageal cancer. The fourth offense was in 2010 when the FDA required Fosamax to include a warning label about risk of thigh bone fractures. In 2011, the FDA committee asked the agency to set a limit on the amount of time patients use the drug. They couldn't agree on the limit and therefore never found one. Since 2003, annual sales of osteoporosis drugs have doubled to $8.3 billion, and $3 billion of that was from Fosamax alone. This drug is produced and sponsored by Merck.
Merck created the Bone Measurement Institute. This led to the lobbying for healthcare reform, then led to the Bone Measurement Act that led to the selling of bone densometers, which led to the sale of Fosamax, followed by increased sales for Merck. Conflict of interest? I think so.